And welcome back. Well, we have a returning guest on today. That was with us a few weeks ago, Dr. Christopher Ninh. He's with the Pacific Coast Orthopedic Institute and also with the Chapman Medical Center, right? Chapman Orthopedic Institute up there as well. Welcome. Nice to see you again.
Thanks, Ken. I appreciate you inviting me here.
And we were here not too long ago. And one of the things that you were talking about is coming up, and we'll get to in just a moment, is a seminar that you're going to be having very close by here, just down the road in Lake Forest. But last time we talked about what's called minimally invasive procedures to help different kinds of joint relief, joint pain. And there's different types of things that you can do, from things that are more minor that you need to do to the major thing, which is replacing the joints and everything in between.
Correct. So I meet people every day with joint pain, and joint pain a lot of times causes people to really limit their activities, their quality of life diminish, it impairs really activities of daily living. And that shouldn't really be the cause. We have new technology and techniques today in which we really can improve and actually eliminate pain. Now, prior to any major surgery like joint replacements, there's going to be supplements, there's injections of lubrication, which is what's called viscose supplementation. It's a series of injections that help lubricate the joints. There's arthroscopic surgery, in which we go in there minimally with a camera and little small portals, little holes. We go in there, you see and look at the knee, we clean out all the debris, and then also afterwards we can do the injections of lubrication and really, give patient a better quality of life, less pain. Now, if it's bone on bone, severe arthritis, there's joint replacement, in which it's a great high satisfaction procedure, which 99% patients do a lot better and literally eliminates all joint pain after 3 months of full recovery.
Yeah, you talked about, you just said arthritis, and arthritis can be, there's all different forms of arthritis. And the one that you're looking at is the erosion of cartilage, right? Because some people with arthritis, like my wife has that, it'll change. In other words, there might be her ankles are hurt one time, and the next month it might be a portion of her arm or something like that. So what is the different types, and what is the ones you focus on?
So there's many forms of arthritis. The main one is called osteoarthritis. And what it is there's genetic arthritis called rheumatoid too, in which you have a genetic component in which your cells literally eat at your joint, but that's more rare. The common one is osteo, which basically it's like a mechanical as well as genetic component. I always refer to it as analogous to like a tire in a car. So with years, you wear out the rubber on your tire, and same thing with osteoarthritis. You have the cartilage on your bones, the surface bone, the smooth cartilage. With time, there's wear and tear. And people who are heavier set, or people with genetic component, with their parents had osteoarthritis, can wear that faster. And when you wear down the cartilage completely, you're bone on bone, pretty much we don't have any replacement for that right now, in which then it's very painful all the time, painful with weight-bearing walking. And so total joint replacement is a great procedure. It's very commonly done. Patients do very well. We do minimally invasive techniques nowadays, which in the hip, we do muscle splitting in the front. And so you're preserving the big muscle so you don't have damage. Recovery is faster, there's less blood loss, and patients do a lot better.
What about, I've heard, you see these ads on TV, and I've always wondered about this. I forget the, there's some kind of a pill you can take over the counter thing, and I forget the name of it, but they say it's supposed to help loosen your joints and things like that. Does that really work, those type of things?
Well, supplements is interesting because a lot of people take what's called glucosamine.
Yeah, that's the one I was thinking of, yeah.
So that's basically cartilage particles in which they kind of make into a pill, and you ingest it, and it's supposed to make your joint, preserve your joint, decreases inflammation. Now, it's not FDA approved. It's like herbal, but patients, they like it. I don't know, it's more of a placebo effect in which they feel better. But as long as you like it and it's not harmful and you feel better and you have less joint pain, that's something that definitely, you can take. It's not a problem.
Interesting. Are there certain kinds of, have you ever heard about certain kinds of diet or food that helps, that has the type of properties in it or nutrients in it that can help you with your joints. Sometimes you've heard about that, certain kinds of spices and things.
Absolutely. So there's many things in which I see a big trend now, in which, of course, vitamin D and calcium is always good for the bones, for bone building. There's, of course, like tea and ginger helps inflammation. And now I'm hearing a lot about gluten-free diets, in which then it's helping the body, because gluten is processed food in which your body gets actually anti-inflammatory effect and causes people to have stomach irritation, joint pain, and now people eating less of that. And they're saying they feel better, that they're having less stomach, GI issue, they're having less joint pain. So we're seeing all these different trends, and nothing's been really proven in terms of taking supplements, decreasing joint arthritis, but it has been shown maybe to decrease inflammation, which decreases joint pain. So that's interesting.
Yeah, the one I hear about all the time now, in fact, I just heard a report about it, is turmeric. People are looking at turmeric, which has been, of course, used in the East for years and years in curries, but now that's like, supposed to help with things like that. I don't know. I guess we'll find out. Doesn't hurt to eat turmeric. So, coming up, you're going to be having a free dinner and seminar nearby at the Pacific Banquet Hall, which, if people don't know where it is, it's right down the street, and it's off of Lake Forest Avenue, and not far from here at all. In fact, you would go down Moulton, and then you would take a left on Lake Forest, and it's right up in there. So not far away, and it's coming up on April 28th. Tell me a little bit about it, and what's going to be happening there? What are you going to talk about?
Sure. So we're very excited. We're getting a lot of reservations, so you got to sign up. So save your spot. You get your free 3-course meal. But I'm going to talk about really information on joint pain. We're going to talk about supplements, minimally-invasive techniques, injections. I'm not going to talk too much about total joint. That we'll save it for another seminar, and not talk about too much like shoulder pain. But I'm here to really educate and disperse information so patients can have a better understanding of what's going on. And then once patients have knowledge, they can make good, sound decisions. And so my job really is to really disseminate good information.
And I think that's the key. People are, whether or not they're having some severe pain or not right now, to come to a seminar that you're having and just get some answers. Because you hear about these things all the time. I think as we all get a little bit older, we get the aches and pains, we get maybe a touch of arthritis, even though we're not maybe prone to getting it severely. It happens to a lot of us, and just to get some of those questions answered, it can be confusing, because like I said, you see these things on the TV, and should we take this, should we not take this, will it hurt us, that sort of thing.
Absolutely. Good information. Don't be afraid of information. Don't be afraid of the doctor. I'm here just to give you good information about medicine and yourself, and then have a good discussion. So.
Yeah, I think it'll be a great thing to go to. I mentioned at the top that we always put on that you work with the Pacific Coast Orthopedic Institute and also the Chapman Medical Center.
Correct.
Now, you go back and forth between the two. Are those your two areas of residency? Is that how that works?
Right. So Pacific Coast Orthopedic Institute is a private orthopedic practice.
Okay.
The Chapman Institute is actually a medical center. It's a hospital, essentially.
Okay.
And I'm the director of orthopedics there. So I have my own private orthopedic institute in which I practice out, but I actually am the director of a hospital and the orthopedic department.
Okay.
So that's how it
So
works.
if people, the number we're going to give you, by the way, today is not Dr. Nin's number that you see on the ad, because this is specific for the seminar, correct?
Correct.
So I want to make sure that we give that to you, though it's on the screen, 714-432-9990. And that's that'll get a hold of you either way, right?
Correct. Yes.
Yeah.
And that is also my office up in Northern Orange County.
Okay. So
Yes.
if they call that number, I know on your ad it's a different number, but it all
Yes.
goes to the same place. I guess if they called that other one and said we want to go to the seminar,
Sure.
you'll find a way, right?
Right.
Tell me about your website, drnin.com. You got a lot of information on there, don't you?
It's a very good website. We have great information on all procedures in terms of injections, total joint replacement. I have 3D virtual surgeries in which they dissect out and they go in detail what the procedure encompassed. And so it's just very good information to peruse around and get a better understanding of what a procedure is. For example, arthroscopic surgery. You can click on arthroscopic surgery and there's pictures and diagrams and images that you can actually go through, and they'll go through some information.
Oh, that's great. Here's your website right here.
Right.
Yeah, I think it's a great. I've gone through your website, and as I said, even if you're not having any problems, it's kind of fun to go in there and look at these different procedures and see how they're done, and get some information, because as I said, we all go through this. Even if you're not prone to anything severe, we're all prone just through aging of something wearing out, right?
Right.
And I think it's a great website to go to. You want to meet Dr. Ninh and go to a seminar. Again, this is coming up on April 28th at the Pacific Hills Banquet Hall, which is down there in Lake Forest, very close by. It's on off of Lake Forest. I always forget if that's Laguna Hills. That's actually Laguna Hills, but it's on the street called Lake Forest. And the number to call them is 714-432-9990. And this will go from 4:30 until 6:30 that evening. And you're going to be providing dinner, right?
Absolutely.
All right, very good. Nice to have you on, and I'm sure you get a lot of people going there. And we'll see you again. We'll talk about maybe shoulder problems next time around. I think a lot of people get that too, right?
Right.
All right, good to see you again.
Thank you, Ken. Yeah.
All right, we'll be back in just a moment.
Don't let any type of joint pain keep you from the daily activities you enjoy, whether it's from arthritis, an injury, or degeneration of your hip or knee. Dr. Christopher Ninh, a highly skilled surgeon, is the medical director of Chapman Hospital's Orthopedic Institute. He's an expert in total joint replacement surgery, using the most innovative and minimally invasive techniques, resulting in less discomfort and much faster healing. Get hip. Don't delay. Visit Dr. Ninh and get back what you enjoy.